Happy New Year to you. We hope that this year will be a good year for you as it relates to your health. Today I want to talk about the diabetic meter or the diabetic monitor. But now you should appreciate how important it is for you to check your blood sugars on a regular basis. Checking your blood sugars is the only way that you can tell whether or not your blood sugar is under good control. Also remember that it's important for your blood sugar to be under good control so that you won't have a bad outcome as time progresses. A bad outcome like a heart attack or a stroke, or your eyes going bad, or your kidneys going bad because your blood sugar was not under good control. The American Diabetic Association has made some recommendations as it relates to keeping these diabetic meters, or these sugar monitors as my patients like to refer to them as. The American Diabetic Association has made some recommendations as to what you need to do to make sure your diabetic meter is in good condition. You probably can't see it, but this diabetic meter has been cracked. The face of it has been cracked. So this is not going to give you a good reading. The diabetic meter that we use in our office is called the Freestyle meter. Number one, it's important that you keep the Freestyle meter in good condition. So keep it in the package that it came in, or keep it in the little pocketbook that you may have that the meter came in. This is to make sure that the meter also doesn't get dirty. Secondly, it's very important that you use the test strips appropriately, and it's very important that the test strips are kept in an environment that does not destroy the test strip. Usually the information will be on the test strip, so be sure and read it. Next, the test strip can be too old. If these test strips are too old, they won't work appropriately in this meter. So make sure that the test strips have not expired when it comes to how old the strip is. The meters usually have to be calibrated. However, the Freestyle meter doesn't have to be calibrated, and that's one thing that we like about it. And then finally, you have to make sure that you have enough blood on the test strip to make sure that the meter works correctly. All of the things that I just mentioned can affect the outcome of the test that you do on a daily basis, or maybe 3 times a week, to make sure that your blood sugar is under control. So if you think you're doing the right thing and your blood sugars appear to be all out of control, make sure that you've tested, make sure that you've checked the meter to make sure it's in good working order. I'm Dr. Thaddeus John Bell, closing the gap in health disparities for African Americans and for the underserved.